Hey everyone, welcome back to the Gut Girls podcast. We are so happy that you're here. And first and foremost, I want to remind you guys, if you're listening, please subscribe to our podcast, share it with your family, loved ones, whoever maybe you recently met that might be struggling in their health, because it is what keeps us going here. So we appreciate that. And we just want to remind you to do that. And so today we are going to dive into, honestly, it was a conversation that was a personal conversation with someone I know, and it stirred up this topic of like, I don't know who to trust anymore, which is very applicable in today's world where AI is everywhere. And to be honest, I know for a fact you guys listening are plugging your test results, images into AI. And I'm not saying don't, I'm just saying you've got to find wisdom, guys. That's what we're going to teach you today in a world that's full of health opinions and options, because even AI, who, yes, may have a lot of information, may not personally know you and may not personally know your history and may not personally know what's best for you. And so we want you to find wisdom on how to approach these topics and who you can trust, because there's going to come a point that even if AI tells you what to do, you then have to find a doctor to do it for you, right? And so who are you going to trust? And this stirred because someone that I know recently was actually diagnosed with basal cell carcinoma, which is a type of skin cancer. And they're having a procedure done. It's called the Mohs procedure, which is a very well-known process to remove it. But as we were talking about, getting the procedure done and whatnot, it was interesting because this person said, our ancestors were outside all the time. I mean, I'm Italian, so yes, my ancestors were out in the sun, working as much as every other ancestor out there, given where you come from. But she made a very good point to say they weren't having their moles removed every week, and it was like, you have a fact there. You know what I mean? Like, this is very true. And so her question was like, are doctors these days just doing procedures to make money? Is it really something like, and it's a very good question. Think about it. We are able to do way more diagnostic imaging than we ever were. So the question came from just a place of uncertainty and curiosity of like, are we just finding more things now because we have the ability to scan for them? And does it all require a process, a procedure to remove it? In this case, I would say absolutely yes. I encourage this person, let's get the procedure done. It is something that you want to take care of. But it brought me back to this question of like, who do we trust and who do we know is going to be honest with us when you're choosing your practitioner or your medical advisor? And so I bet a lot of you guys listening today have either a similar experience or have asked that question before.
Yeah, and I mean, maybe we're not all talking about skin cancer here, but it's even this, I'll use the term simpler things, right? It's like, well, one person tells me that I should wear sunscreen. The other one says that sunscreen causes cancer. One person says that I should eat lots and lots of meat. The other person says don't eat meat at all. One person says eat coffee. The other one says, coffee will spike your cortisol. It could be a woman looking for hormones where, should I be on hormones? Well, the other person says, no, you shouldn't be on hormones. And so the women, and primarily we work with women, it's like we're asking so many questions. Who do I trust? And there's so many resources, right?
So many. And I think that, of course, we all are looking for certainty, right? Everyone wants certainty. We want someone to be like, this is the answer. This is the diet. This is the supplement. This is the doctor that you want to go to. And guys, it's just not that simple. Like, it's just not. Our bodies are hugely complex, diverse, unique. People are different based up, like their bodies, you guys know of epigenetics, meaning like even if you're given genetics, the DNA from your mom and dad, where you live and how you perceive the world around you and what you do lifestyle wise can change the trajectory of whether those genes are turned on and off. So, I mean, sometimes the wisest answer honestly isn't the simplest one. Like you said, Diana, like eat the meat, wear the sunscreen. Like sometimes it's not the simple, straightforward answer. And I think we've become uncomfortable with that. In fact, Dinah, you and I would say that's probably one of the biggest barriers as to why people maybe don't come on board to do some of the gut healing that we do, because you and I know that transformation comes when the individual gets to know the nuances of their body. So I'm going to be so upfront to say we are not the people that we're like, it's this diet, it's this supplement. If that's what you're looking for, that's kind of what I want you to listen to this whole podcast to kind of understand is you need in healthcare, you need someone who is going to understand your nuances and speak to your lifestyle and your health goals and desires, right? And so we're kind of going to talk today a little bit about when you're seeing the doctor, the specialist, you're signing up for the next program, what are you going to be looking for to know that this person is really gonna help you and speak to you?
Yeah. And just like you said just a minute ago, that's why, a lot of times when you join us for these programs, it's not like, oh, we're going to cure you in 1 week. That's not how it works. So if that's what you're looking for, then working with us is not the right answer. If we do the foundational work, we do a lot of different things to help optimize our health. And we totally recognize we are not medical doctors. We say that often here on the podcast. But one thing that we try not to do is be that, loud voice on TikTok or loud voice on Instagram, because it does seem like the people with the most followers, the biggest voice, sometimes the attention goes to them. And so everybody thinks they need to do a parasite cleanse because this girl with 1 million followers says that everybody needs to do a parasite cleanse. Well, you and I know that is not best for everybody, because a lot of people don't have a healthy enough gut microbiome to be able to handle a parasite cleanse at the time. Yeah. So it's those kind of things that it's like, just because these loud voices on social media doesn't necessarily mean that that's what's right for you.
Yeah. And we're not saying that those are bad necessarily. And I think, you and I would say there's a time and place for a parasite cleanse, antibiotics, all that stuff. But it's knowing, like you were kind of pointing out, so I'll just say it a different way. It's knowing where you're at to know what your body is capable of receiving, because then what we hear is the woman who comes to us that's like, I've done everything, the parasite cleanse, the newest probiotic, the colonic, like, the latest colonic out there, and none of it's worked. And it's like, I'm sorry that you are frustrated and you've spent thousands and thousands of dollars. I wish someone would have spoke to your body, like individually, uniquely your body, and not, you didn't get caught up in what someone was speaking to the whole world, right? Like that's the difference. And you'll be thankful. I'm just saying this because I know from testimony after testimony, you're more thankful as an educator in the medical field, as coaches, we're always taught, teach the individual to fish. Don't just hand them the fish and be like, here you go. It's like, no, teach them how to, actually fish and what to do when they catch the fish and reel it in. That concept is more like, you guys are going to be thankful when you know what to do and the doctor is on vacation. You're going to be thankful when you know what to do and that office just shut down. Like, think of how many times you guys, probably many listeners have been in that, like, well, that doctor just left and they were the only one that could help me. Gosh, that has to feel like your back's up against a wall, because we don't want you to, it's not just that one person. It's like Dana has said before, becoming your own doctor, knowing your body and knowing what you need. And I have to take it a step farther, Diana, to go back to that question that kind of prompted this whole podcast of like, well, our ancestors didn't get all this done and they didn't have to work this hard. And I want to speak to that because there is curiosity in that and there's some truth to that. And I would say it's a complicated question because our ancestors also lived in a different world. They walked everywhere. They did not have the same a level of transportation that we are blessed with today to get us here and there. They walked everywhere. Their movement was a part of how they got through life. So they did not have a choice to move or not. They had to survive. So movement was there every day. They ate, guys, completely different. Even we've had this topic before, Dinah, in our membership about people have asked about gluten. Like, why is everyone now saying you can't eat gluten? It's like, okay, well, the gluten is the food is different, guys. Food is different today than it was then. I mean, we went through the whole, the whole industry of food has changed, and how it's processed and how it's made and how it can sit longer for convenience on the shelf. So like, food is different. It's not as fresh. We also are surrounded by plastics and chemicals, pesticides, herbicides. They were not. It was a completely different lifestyle. Environmental toxins, all that was different. And so also the stress, I will say one thing is the social media. Even though it's a blessing, guys, we are bombarded with what everyone else is doing, where our ancestors really just worried about what was right in front of them and their family, and that was it. So yes, times have changed, and our ancestors definitely treated, they may not have had the moles checked, they may have not had these procedures done, but it was a different world too.
I mean, it really was. And the different world goes back to people wanting like a quick answer, right? Just like we were talking about with the parasite cleanse or whatever it may be. But it's unfortunately, it's not that simple. I mean, our body is really complex, and it's all interconnected, isn't it? And I mean, so people ask us, okay, so if I'm going to work with you, the Gut Girls, are you more conventional? Are you more functional? And we don't love that answer. But because I don't feel like we have to choose sides. I mean, I believe our goal is so much of a preventative measure, right? By working on the nervous system, by working on our nutrition, by working with the movement, and then having this community and the supportive group, and we work through sleep and all the different things, and all of that is so important. That's what our focus is on Gut Girls, to help you optimize those kind of things. But then, there are some times, and we're happy to admit that there is medication needs at some points. I mean, this has never been our goal at Gut Girls to be like, hey, you don't need, conventional medicine. You should do it 100% natural, or, whatever, because we realize and recognize there's a time and a place for that. And I'll give you a personal example of that. I've shared on here that it's been, a year, 14, 15 months ago, that my husband was very sick. I mean, couldn't get out of the bed. He's never had the flu. We've been married 19 years. He's never had the flu. We went day after day after day of him not getting out of bed. And, we've always joked, he said, you don't ever take me to the hospital. I don't want to go to the hospital, But I told him, I said, if you go 8 more hours and you're still in this bed and you're not any better, I'm taking you to the hospital. And I did, because guess what? He needed a really strong antibiotic, because he was diagnosed with both Rocky Mountain spotted fever and alpha-gal syndrome from a tick bite. And so his body absolutely needed an antibiotic at that time. So I am never one to reject that, because there's absolutely a time and a place for that. And Todd obviously needed it.
Yeah, we have other members. I think of one particular where, we work with them while they're doing, allopathic medicine. Like, I think of one that has a history of colon cancer and currently still in the midst of screening and testing, and she's working with us to optimize her gut. And I think the beauty of both is really what is speaking life into her right now. It's beautiful. Actually, the blend is very beautiful. And so let me kind of give you some advice on, like, how do you do that right? How do you do it well? How do you know who to trust? And so I would say one is, you want to ask the right questions, right? When you are going to see a clinician, or when you're, trying to figure out the next steps, it's more about, it's not who's better than the other, or like Dana said, who's more functional versus conventional. It's who's going to support the body, the whole body, as much as possible, and who's willing to work with a team, right? When there's that one practitioner that's like, we're going to do it this way, and it's like, no, realize that a team is going to catch way more, right? But then I pause to say, too many hands in the fire and you're going to be overwhelmed. So you've got to build a team that's willing to communicate with each other. That's the key. Teams that are willing to play off of like, okay, they're working on the gut, so we can continue to scan. And I'm thinking of her particularly, but scan and make sure that nothing new is popping up. And so you want to work with a clinician or a practitioner, MD, whoever you're seeking, that addresses food. Food is key. Food is medicine. So if there's a clinician out there that's like, it doesn't matter what you eat whatever you want, but this is the treatment you need to get, I am sorry to say that they do not understand the body fully, because food is medicine. And if you're not using that as medicine along with, allopathic medicine, you're not going to get the best results. Also, your lifestyle. If you have a clinician that's not addressing your lifestyle habits and asking you about sleep and, are you getting hydrated? Are you getting movement? Do you have a community that will support you through this? Like someone that's asking you about being isolated in this versus a community. Guys, these are the questions that they should be asking. And if they're not, these are the questions you should be asking them. And if they're like, oh, that doesn't matter, that's not important, we don't need to worry about that. Personally, I would be seeking elsewhere.
And I love that about us being as coaches. I'm going to kind of pat us on the back a little bit, because I do love the fact that I am 100% willing to say, you know what? I don't know the answer to this. And so, you and I put our heads together, and then we contact other practitioners. We do our own research and look at, physicians in the area. Hey, we really feel like you need to go see this person or that person or whatever. So, I feel like that's one thing that we do really well. Again, we try to teach the foundational work, and we're not going to diagnose or treat anybody with the Gut Girls, but we can work with you on all the foundational things that I can promise you, whatever physician that you're going to see, you need to do, just like Angela said, all of that work alongside whatever your physician is doing, because you've got to have all of that is so key for your body to actually heal with whatever they're suggesting. So that's why we love to walk alongside.
Yeah. And we say it all the time, the gut keeps the score, but the gut is also your second brain. So women, there is that intuition that comes from your gut. It is real. And we at the Gut Girls, the reason why we focus on the gut so much is we believe in that intuition. It will speak to you. And so when you are, maybe like, who do I trust? And who's going to lead me the right direction? I think the better question is, how do you become an individual who knows how to discern? Like, that's really it. And when you are highly inflamed, when you are not taking care of your nervous system, which we literally just talked about this in like one of the previous podcasts, you don't have the capacity to discern what's going on around you. You are in fear. And then when you find a doctor who's doctoring you out of fear, gosh, that's the worst. I mean, that right there will prevent you from getting better, because fear will outdo any medical procedure. It really will, because that is your nervous system. It does not feel safe. And if your nervous system never feels safe, you will not receive any treatment, medicine, supplement that you are being offered. So we really want you, the biggest goal that Dan and I have here is to become a discerning woman, and to know what your body needs, and to ask the right question and fight for that. If that doctor is not willing to answer those questions, go down that path, your doctor is hot. Like, you guys keep your doctor in business, right? If we didn't need them anymore, they would be out of business. And so you keep your doctor in business. And so kind of speaking to them of like, I'm here, this is what I need in order to trust you and receive care from you. And if you cannot provide it, thank you, but I'm going to kindly pack my stuff up and go to the next office that's going to provide it for me. Like, you get the right to do that, and kindly, obviously. But I think often enough, we don't do that. And so anything else, Diana, that you want to speak to that?
No, I love that you said that. There's a really kind way that you can do that. And when I go back to what I was doing in 2017, I do what I call going through the cycle of trial and error. I hopped from doctor to doctor to doctor. It was so incredibly frustrating, and none of them talked to me about my diet. None of them talked to me about whether I was sleeping or not, what my stress was like. And I'm not trying to shame those doctors, but they weren't the right people for me. I wasn't finding the right people. And so even though I was hopping from one to the next, it was a specialist versus a specialist. So looking at one, they were just studying one piece, like just looking at just my skin, or going to a gynecologist that wasn't necessarily trying to figure out why my hair was falling out or whatever. And it was all this big piece of the puzzle that really needed to all come into one. And so, during those times, I was seeking somebody that not only that I could trust, but somebody was providing me hope and providing me a different path hey, maybe you need to pump the brakes on trying to figure out some major diagnosis. And maybe we just need to optimize what you already are attempting to do anyways. You just need to tweak a few things. And so I tell people that all the time. I'm like, when you come to the Gut Girls, it's like putting all those pieces together where you've been trying to search for all of these answers. You're doing AI, you're following all the people on Instagram that your mom says you should follow, or your sister says you should follow, or and I've tried all the things. I've cut out gluten. I've cut out, we talk to people all the time. I've cut out gluten and dairy and sugar. And I'm like, oh gosh, are you living your life?
It's so true.
So we're trying to pull all of that together with Gut Girls. And I love that about us, that I want to be somebody that you can trust and that can share experiences with.
Yeah, a certain case comes up in particular of a woman in her childbearing years whose nervous system is just spent, as you guys can imagine. Little kids, I think she's got 3 or 4 kids. Her nervous system is spent. And it was interesting because working with her, and I'm not saying, guys, like the Gut Girls are the only people that you should trust. We're not saying that, but I want you to understand what it should look like in a sense, because maybe you've never seen it played out right before. But it's like, okay, let's start with the gut. Okay. So we start with the gut. Honestly, with this in particular person, we were able to find out that she has celiacs, and no one has ever been able to help her understand, like, all these symptoms that have been unexplained. Suddenly we're like, oh my gosh, this makes complete sense. But then it was like, okay, teaching her that celiacs is not just about going gluten-free. That's not all it is. But a lot of people out there will tell you, like, hey, your celiacs, just go gluten-free and you're fine. It's teaching her how, okay, now that you know that, your nervous system responds different than other people that don't have celiacs. And it was interesting. We kind of kept testing, and that's what you want. You want to work with someone that's like, okay, so we found out one layer of the onion that we took off, and you're 30% better. So there's still more work to be done. So let's keep going. And we did a mold test on her, and there was a mold that came back that was high in aflatoxin, which is found in a lot of things, but primarily peanut butter. And how awesome. Literally, I remember having a consult with her, and I was like, okay, so do you eat peanut butter every day? And I didn't even know this about her. And she was like, oh my gosh, almost every day. And I was like, we got to talk about the peanut butter, because being celiac, a normal person without celiac could probably handle that aflatoxin mold from the peanut butter, but she was celiac, and she's in her childbearing years. Her nervous system is fried. That little bit of aflatoxin from the peanut butter has been life-changing for her to get better sleep, be a better mom. So you see how that would have probably gotten overlooked in the normal conventional world, because it's like, hey, your celiacs, just go gluten-free, and you're in your childbearing years, so this is just how life is going to be. You're just going to have to learn the new norm. And I just don't, personally, if I'm told that, I'm like, no way, I'm not going to settle for that answer. And so, guys, I'm just giving you an example of that's what it should look like. Working with someone who's like, okay, we're not 100, and you may never get 100%, but we're not where you want to be. I should say that. We're going to run another test. We're going to peel back the layer, and we're going to look at you individually and not everyone else out there. I think that is key. And so if that excites you guys, if you're like, heck yeah, that's what I want, we're inviting you into the Gut Girls, and maybe it's just the starting place for you. or maybe it's the ending. Like we see everyone. It's the starting place for some people. And we have a membership that does speak to those that are like, I want to get started in this kind of community. We have that for you. If you go to our website, you will find that you can join our first tier 1 membership that is just called that. It's called the Self Starter. It's at a very low cost, $15 a month, guys. That's like what you spend on a Starbucks drink if you're out there drinking Starbucks every month. It's actually probably less than that. So it's like you can actually join us and get your toes wet in this type of a community if that's what you're looking for. But then we have the people who are just overwhelmed and fried. They've done, Dinah, what you've done, the cycle of trial and error. And they're like, no, I'm ready to go all in. Like, I'm not just getting my toe wet. I'm like, put me in the water. I'm ready. And we have a membership for them called the Guided Transformation that they can join. That's a little higher price, but it's a 4-month commitment that we walk you through. You're able to get access to the GI map and get that gut testing, and you're able to get weekly calls with us. Guys, if you like these podcasts, imagine talking to us every week in person. It's epic. It is life-changing calls. These women feel seen, heard, understood. They have a community. They're not in isolation. Every call we see healing happen. Diana, it is amazing. So Diana, remind them the website, anything I missed that they can join.
No, I think you got it. On our website, gutgirls.health, we actually have the breakdown of how I'm looking over here now, if you're looking at the screen, because it literally says choose your journey, and it says flexible support tailored to your gut health goals. So I love that that's exactly what it is, but it's not just about gut health. If you're, maybe you're like me, and I didn't know that it was all connected to my gut, and I was having all these symptoms, the joint pain and the hair loss and the headaches and, the face rashes and everything. And, maybe it is all tied to the gut. And so I encourage you to dig a little bit deeper. And we're not saying that you can't trust other people, because there's lots of other people similar to the Gut Girls that I think would be great for you to work with. But if you've done what I've done and you've gone through that feeling of overwhelm and just exhaustion and not understanding like who to believe, and really not even knowing the right questions to ask, try to stay curious. Come to our website, look a little bit more, and look at some of our testimonials and things that we have on our website. Listen to those women. Those are real women, just like me and Angela, and maybe you listening, that have different things that have come up in their life and different reasons for working with us as the gut health coaches. And so if that's you, we would love to work with you too. Just like Angela said, head to our website, gutgirls.health, and we will see you on the next podcast.
The Gut Girls podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. We are not acting as licensed medical professionals. Always consult your doctor before making any changes to your health routine.